Are we on? What do you see? Okay.
There we are.
Hello, everyone, and welcome to our virtual in-service training here on achieving efficiency with optimized technology. We are quite excited to welcome you to this APA medical event. Thank you for taking the time to join us. I see a lot of people are already joining, but this event did gather a lot of interest, and I'm going to just crave your indulgence to give us a couple of minutes for others to join in.
And thus the trickling in begins.
Yes. There is a chat function there for anyone who is having any technical problems. Send out a message.
We will absolutely hope for no technological issues today.
Fingers crossed.
But good to see everyone joining. See some familiar names out there.
All right. I think more than half of those who indicated an interest are already here. And so we are going to go ahead and start, and those who are coming in late will still have a chance to catch up on this presentation, because we'll be providing a recorded version of this training afterwards. So once again, welcome to this virtual in-service. We'll be sharing our new digital assets to all of you in the hope that they can help optimize your operations and make you become more efficient. To start things off, here is the agenda for today. By the way, I am Brendan Pante and I go by Shufai, so I should have said that right at the beginning, but anyways, the agenda for today is what you have on the screen here, a bit of housekeeping. I'm going to be introducing somebody who needs no introduction at all. Then we'll do a quick overview of APA, and then we look at the those technology and efficiency as it relates to your work. Then we do a demo of the assets that we promised you. There will be a quick poll here, and then question and answers, and then we'll close up for today. Now, if you are looking at your screen, you probably are seeing this. So right at to the bottom there, you can click on the Q&A to ask any questions. There is going to be a poll, and at that time I will let you know. There is the more button here, which will provide you with any other things that you want to see. There is also a chat function when you get to the more, and you can just chat with us and send us information, or you can use the question and the Q&A button here to provide any questions that you may have. And now to the lady of the hour. I am super excited to introduce our very own Emma Cobold. She's our customer service manager. Emma, to many of you, needs really no introduction, but she has spent her entire professional life within this space. She is a very dedicated customer service rep. She's very she's super interested in helping anyone, not just case managers, but any case coordinator, parents, anybody coming to us get what they need, right? And she is an authority when it comes to how can we use technology, how can we leverage the resources we have to get down on timing and deliver service to our patients, to our clients on time, so that they can live dignified life. This is her passion. This is what she does. She lives and breathes this. So we are very excited to have Emma lead this. So thank you, Emma. And for those who are new to APA, we truly are a partner. We don't see ourselves as a provider of home medical equipment and services. We we have a vision to become that trusted name in the medical equipment space, because our intent is to make healthcare easier through a steady and trusted and honest communication that really counts on real human connection. Our mission is to simplify the DME experience, and we navigate complexities and deliver the service, answers, and equipment people need to move forward. That is who we are. And we do this with 3 core values: proactive spirits. We want to anticipate the needs of your clients, the needs of case managers and case coordinators, and get those needs responded to, right? So that you can deliver smarter and simpler experiences. We have genuine care. All our people here at APA love what they do, and we bring people first service to every interaction. We listen, show up, we treat each other the way we want to be treated. And so we also do this with stubborn diligence. We don't want to let anything drop through the cracks. We don't stop until we dig in and find the details to push through and ensure that that piece of equipment, that supply, that service is delivered to that patient. Because whenever the patient is coming to us, they are already in need of something. And so we want to make sure we are delivering these things with these core values. So and now we move on to the real show, which is the demo for today. Emma, our people on the line here, I'm very excited to see what we've got for today.
Absolutely. So hopefully you guys are excited for this. I know some of you have heard stories about some of the stuff that we're getting started. If you were at MSSA this last spring, we talked a lot about new website, new catalogs, and a new portal that we'd be launching. Well, it's happening. I know. It's very exciting news. So the goal here is to hopefully make things a little easier for you, for the members that you're servicing, and just bring, DME into the 21st century. I know it wasn't that long ago that a lot of us were pulling carbon copies for paperwork, even some of those prescriptions. So this is a pretty big change when it comes to our industry, when most of prescriptions and documentation and stuff is still done via fax. We like to hang on to the Stone Age when it comes to our industry. So I don't think that's any surprise to any of you folks here, whether you're new or old guard. But one of the things we really wanted to start doing was revamping, refreshing. I know it's been a while if you've seen our last catalog. 2022 was a few years ago. It feels maybe even further than that after COVID, but here we are actually getting some changes made. So if you've been on our website recently, you'll notice it looks a little bit different. We've streamlined some of the stuff on there, refreshing a lot of the products that are offered there. One of the big things is pulling off some of that stuff that is no longer available. So there should be no more calling in and saying, I would like to order XYZ for my patient, and being told, I am so sorry, that has been discontinued by the manufacturer. It's not ideal. We don't want that to happen. So we've been going through refreshing what we have offered so that if it is something you or your member needs, we have it here available. You can see what it looks like. You'll be able to look at that if you're in somebody's home to say, hey, this is what this product is. Is this what you're looking for? Is this what you've had a discussion with your doctor about? Things like that. So as we're looking here on the website, we've got a couple of different things. We have a search function here. So if you know approximately what you're looking for, if it's a cane, if it's a bath bench, if it's a lift chair, a commode, you can use that search function to get where you need to go and find where that core of the item that you're looking for is. We do also have the drop-down menu here. So if you know kind of the category, but maybe you're not 100% sure what the item is called and what it looks like, you'll be able to use some of these drop-down menus as well to navigate to where you need to go. If you just want to go and view products, you absolutely can do that too. And then probably the biggest difference that we've not had before and we now have is the ability to build a cart. So you'll be able to go through the whole website pick out whatever products you need for your member and be able to create a cart. So if you're going into folks' homes to be able to evaluate them, do their reassessment, have that conversation on exactly what they need, you'll be able to pull up pictures of the products, go through it together, or have them look and tell you what they're looking for and actually build a cart to check out. When you do that checkout, it's going to send us a message with exactly what the cart is. It's going to come into our system so we can get that order started for you guys. Now, if there's additional information that we need, we will absolutely reach out and give you those questions like we normally do. But you don't have to call in, especially if you're in the middle of things. You're driving to and from members' homes, you're doing reassessments, you're in and out of houses, offices, all that good stuff. We know that your time is being eaten up by all of this other stuff. We want to try to make this as easy as possible, so you don't have to make that phone call. You don't have to type up that email. You can just pick, check out, let us know who you want that order for, and we will take it from there. Again, trying to make your guys' lives a little bit easier. We know this at this point in time, everyone's caseloads are bigger than they've ever been. You guys are being asked to do more than you ever have. How do we make your lives a little bit easier? Because if we make your lives easier, hopefully that means we're able to make your members' lives a little bit easier as well. So if we are going over to John Doe's house, we know he needs some incontinence supplies. He hasn't been getting them for a while. We can go over to our incontinence. We can just click on incontinence as the header and decide what products we want from there. Or we can do a drop down to say, I just want to look at briefs, or I just want to look at pull-ups, whatever the case may be. And we can go ahead and just build a cart from here. So we know, he's going to need a medium. He's going to want 3 packs. Maybe we want to get some wipes as well, just to make sure that, he's staying clean, which is hygiene is key for keeping people, healthy and safe and at home and stuff. So we're going to add some of those as well. And we're going to say, yep, that's everything that John Doe needs for today. That sounds good. So all you have to do is go over to the cart submission here. We're going to ask who this is for, so that when it comes over onto our side of the fence, we know whose account to put it on. Or if we're creating a brand new account, that's totally fine, but we've got the information to be able to do that. So we'll say this is for John Doe, date of birth. Some people say I wasn't born yesterday. Well, John Doe was born yesterday. We're just going to go with that. We'll put in a phone number for John Doe. Go through that. Patient email isn't required, but if they do have one, it does make it a little bit easier to get in touch with them if we do need to ask them additional questions, like who is your doctor, do you have a prescription, stuff like that. And then who are you? What applies to you best? Are you the case manager? Are you the patient themselves? They can build their own cards if they would like to. Caregiver, whatever that case may be. In this case, probably the case manager or care coordinator. So who are you? So we know who to send that quote to, who to reach out to if we need some additional information on that. So in this case, I am case manager Emma Cobold, and I'm going to put my information in here if I can type. There we go. And then whatever your phone number is, just in case we do need to get in contact with you. Very exciting phone number here. Absolutely. Now, another really helpful thing, if you do have the PMI number for the person, it makes it a lot easier for our folks to be able to pull the patient up in minutes and make sure that we don't have to ask you who their insurance plan is. If you got a PMI number, that is fantastic and super, super helpful for us to make sure that we're getting their insurance information set up correctly, and just making things go a little bit quicker. Again, our hope is that we don't have to bother you and ask you a whole bunch of questions, but that helps a heck of a lot in being able to get them set up. If you know who their primary payer is, and you may not if you're just a waiver case manager, you may have access to that. I know not all organizations do. That's okay. But if you are, contracted with the, a UCare, a Medica, Health Partners, a Blue Cross, and you know what the plan is, if you put that on there, again, that helps just point us in the right direction to be able to obtain some of that stuff. So if you're able to, it makes things a whole heck of a lot easier. So if we go ahead and place order, it'll say thanks for submitting the form. That'll come over to our side of the fence, and we'll go ahead and get that order placed and do whatever follow-ups we need to do with the doctor, with the patient, and if we need to, we will reach out to you. But that's kind of what we are hoping makes things a little bit easier for you guys. And of course, please, by all means, do call us, email us at apa@apamedical.com if that is your preferred method of reaching us. This does not negate from those other methods of contact. We just want to make sure that there are other options out there, especially as you're on the go. We know those aren't always the most convenient options. So that is the big difference that we've rolled out with the new website. The other big thing is a new catalog. I know it has been a long time coming. 2022 was, it's a while ago. So we do have a new catalog that we have on the website now, and it is actually compatible with mobile. I know some folks have tried to pull it up on their cell phone with the old catalog, and it's doing weird stuff. It's going all over the place. So one of the things that we knew was really, really important was being able to pull this up on other means of technology. So it doesn't have to be just on a computer. Especially when members are pulling this up, they may not be technologically savvy enough to pull it up on their smartphone. They may not have a smartphone, but this is going to be compatible with things like an e-reader, a Kindle, stuff like that, your mobile phone, your computer. If they don't have a computer, maybe they're more comfortable utilizing a smartphone or something like that. So this will have the functionality to be able to be used like that for people to be able to access and look at it and see what it is that we do offer, and make sure they're getting products that are going to be able to help them live in their home longer, live healthier, that sort of thing. So we do have a page turning functionality with this as well. So you can actually page through. And if you are on like a Kindle or an e-reader, you can literally swipe through like a book. Hopefully this is something that makes it a little bit easier, a little bit more user-friendly for those folks that maybe aren't super technologically savvy. It has that feeling like, oh, it is an actual reading material. So you will be able to go ahead and page through. If you are on the mobile version, there is a table of contents that you can open and click on and then just go through very, very quickly and easily, rather than having to tab through every single thing. If you know you're looking for a particular section like bathroom, like bedroom, you can just click on that on mobile as well. But if you're looking at it as, kind of this PDF form, you can just quickly scroll through some of that stuff to be able to move around effectively and, make sure you're getting to where you need to go without wasting time. Again, trying to make your guys' lives a little bit easier, a little bit more efficient wherever we can. If you do click the shop online, this will bring you back to the website as well. So if you do want to go ahead and add that to a cart as you're looking at that, within the catalog, you absolutely can click on that. It'll get you back over to the website, and you can add that to a cart if you want to. Or if you just want to see a bigger picture or go into some more details, just because there's only so much space that you can fit it in on a catalog and stuff as well. So that being said, when am I going to get a hard copy? Because I know that's been a thing and we haven't had any in stock for a while. We don't have any available at this moment. We're hoping to have that first thing probably into the new year, to have some of those hard copies. Because again, we know that there are folks that it works better for them to be able to have that hard copy to show and bring places and stuff too. So if you are somebody that really appreciates having a hard copy around the office, we will absolutely be printing hard copies again so that we can get those mailed out, or we'll have them here in office too. If you ever want to swing by our showroom at our location here, absolutely feel free to come in and pick some up, but we should have those available probably early to mid January is what it's looking like right now. We just have to get everything printed out and here so that we can get those sent out. So that is in the plan as well. So if you do think, oh gosh, I have people that would never be able to pull that up on a phone, a computer, or a tablet, anything like that. They don't have access to that, and we understand. So we will have access to something like that as well. So hopefully that is helpful in that regard too. All right, so as we move on, the other big thing that was, we were talking about that we've pushed out some, emails and stuff around is the case manager portal. So some of you may be familiar, some of you maybe even looked at this before. This may be brand new to some of you as well, but, and we'll send out links to everything after this as well. So if you're looking at this going, oh my goodness, what is this? I would love to use this, but I don't know how do I get access to that? Don't worry, we will send out some links so that you do, if this is something that works for you. You can either sign in and create a login so that you can just sign in, whenever you need to, or if you have any issues or you're having a hard time figuring out how to do that, you just need your email address. It'll ask you to create a password and stuff. There is a single sign-on option if that is easier for you as well. You just have to do that every single time. It'll send a link over to your email to be able to sign on. So if you are a case manager within our system, you should be able to use that single sign-on because we have your email on file. That is what tells us that you already signed up to be able to have access to this. So any orders in the system or any patients that have you listed as the case manager will show up under your basically list of patients on here. So if you have somebody that's no longer on your caseload, just let us know. We'll get you taken off or switched over to the new person. If you know who that is, that's great. If not, we'll just get you taken off and follow back up with that patient to see who they're, moving to or moved to, so that we're not bothering you on that sort of thing as well. But once you log into the portal, you'll see a couple of different options. The first one is being able to track your quotes. The second one is being able to track your orders. It is not the most robust system, and I'm a little bit embarrassed just because it doesn't have as much of the stuff fleshed out that we would like to have, but we'd rather have something for you guys to use than just having to call in and email and say, what's going on with my order? What I haven't heard anything, what's going on? So if we go over to the quotes portal here, so we've got some orders here for our good friend John Doe. He's got a lot of stuff that he needs. We appreciate that. You'll be able to also just jump between patients up at the top, and this is for both the quotes portal and the order portal. You'll be able to very quickly move between patients if you want to see. When it comes to the quotes portal, this is only going to show you outstanding waiver orders. So if you tell us that the service agreement or the authorization request has already been submitted, it's been requested, approved, whatever the case may be, it will no longer show up for you. Or if we've gotten the service agreement and it's moved on. This is for stuff that is outstanding, we haven't heard back from you guys on, and we're waiting to know whether or not that auth had been submitted. So we know that we should be pestering Medica, pestering the county, checking in with UCare to be like, where's the service agreement? So if it is showing up here, it means we haven't received anything, and that's why it is still there. So as stuff comes off, it means it's no longer needing you to follow up on it. So if you're like, gosh darn it, I've already done all of the things, why is it still showing up? If you let us know that that auth is submitted and you say yes, what that's going to do is it's going to take that off of your plate. You're going to stop getting those automated follow-up emails to be like, hey, have you submitted? Hey, what's going on? Did you forget about this? We're trying to make sure that we get you guys the reminders because we know there's so many people with so many orders going on. It's hard to keep track of. So we do want to send those follow-ups just to, make sure that one, we're not forgetting, and also make sure that it's a good reminder for you in case you do maybe wait till the end of the week to put in all of your auths for everybody for the course of the week. I know some people do it that way, some people do them as they go. It may just depend on your caseload and the types of plans and waiver programs that you're working with. So whatever works for you, by all means. But once you know that that auth is submitted, let us know. That way we can stop pestering you on that stuff, and it keeps us in the loop to say, hey, we should be following up on that service agreement because it should be with UCare, should be with the county on Minutes' portal, and we can go double check that and make sure that nothing gets lost, because we know the county sometimes eats that stuff. Sometimes UCare forgets to process that request. That's okay. As long as we know that's the case, we know what our course of action is. So if for some reason you're like, shoot, I forgot about that service agreement for John Doe, I need to do that, but I don't know where my email is, I don't have access to it, I just need a copy of that quote right now. what do we need to do? What you're going to want to do is just grab that copy password. That is going to pull the passcode for it, so you don't have to copy and paste and do a whole bunch of like typing or anything like that. And then if you go over here to the quote, you're going to go ahead and hit open. It'll prompt you for that password that you just grabbed from the system. Paste that in, submit. Ta-da! You will have your quote ready to rock and roll. So you don't have to wait for us. You don't have to wait for us to sit there and send it back to you if we're being a little slow, if we're short staffed for the day or something. Like, I hate that you guys have had to wait for us on stuff like that. So this is a way to to engineer around that and not wait on us, because we don't want that. We don't want to waste your guys' time waiting for us to do something like that. It'll give you some, information about what's on the order and stuff as well at a glance. Which one am I dealing with? Oh, this is the one for the chucks and pendant for a lift chair. You can see when it was created. When did you probably reach out to us? When did it get put into the system? And just a quick status on where that order is at. That becomes a little bit more useful once you get into the orders portal, just because you're going to have a lot of different parts of where that order might be in process. Once it's here on the quotes portal, it's pretty much just waiting for the service agreement. So not a ton of information that's surprising there. It's mostly self-explanatory, but by all means, if you guys have questions on this and stuff, we will have that QA. So if there is anything that you're like, I want to ask or see a little bit more on, by all means, continue thinking about that. So that's a little bit of the overview for the quotes portal. Once we get over to the orders portal, again, you'll have the ability to jump down to whichever patient is on your caseload. And again, if you have somebody that's no longer there, they've moved on, honestly, a lot of folks have been like, oh, this person is deceased. I may not have remembered to tell APA that. We'll find out eventually once we go to bill, and if they're on auto order or something, that stop hold report will say, hey, nothing went through. We will eventually figure it out. But if we can prevent that and get that done quicker and more effectively, we're not following up on with you to say, hey, did you get that service agreement in for the person? They're like, oh, they are deceased. Okay. We don't need to bother you on stuff like that too. So you do let us know. It's great. But this is a great way to see and make sure that your caseload is being reflected accordingly on our side too, and make sure that we are not bothering you on somebody that is no longer on your caseload. But once we start looking at the ordering situation here, obviously John Doe here does not have a ton of active orders, but it's going to show you where it's at. Is it waiting for a prescription? Is it waiting for a service agreement? If it's waiting for a prescription, we're waiting for that doctor to probably send back documentation. Is it with insurance verification, where we're checking benefits with the health plan or making sure that the waiver is still active? Is it waiting for the parts to come in? All of that is going to be shown here for you, so that you don't have to sit there and make that other call. Again, we're just trying to make things a little bit easier for you guys, so you're not waiting on us to say, hey, what's going on? Where is my order? What's the status and stuff like this? It'll also show you if the order has been delivered and when it was delivered. So if you have a few members that are sitting out there going, they're not great about responding to you and returning your calls to say, I got the bath bench, I got my pull-ups. You can check here to say, it was delivered and this was the date that it was delivered, so that you can close that out in your own records and not have to be chasing down that client to be like, did you get the bath bench? Did you get the thing? So we're trying to put as much information that's useful for you guys as possible and try to keep out as much noise. But again, if you guys have feedback on what you would like to see here, we would love to have your feedback on some of that stuff as well. You will also still have access to that quote. Again, if there is a delivery date, it will be there so that you have some of that information and can plan accordingly. If you do want to call us, all you got to do is click that phone number icon and it will say, do you want to make that call? It'll connect you directly with our call center staff to be able to assist you. If you do prefer just to call and stuff, we want to talk to you. So please, by all means, do not feel like you can't call us or email us either. That will come directly to our APA at email. which all of our reps work out of, and is managed by our leadership team as well. So if you do have anything that you do need to check on a little bit more in depth, or just have questions on what the process is like, we are happy to be able to go over that in more detail with our call center staff. So that is kind of what we have had in development, what we've been working on, and hopefully this is something that is going to be useful for you and your members, or the rest of your team if you're in here, you know, sitting through us talking at you this whole time, to be able to report back to say, is this any useful? Is this good? Is this not great? Like, what's APA doing over there? So hopefully this is something that will make your lives a little bit easier. But we'll go ahead and move over to the next portion of the presentation then.
Thank you so much, Emma. A lot of information there. And before we dive into the Q&A, I just want to share just a little bit about the catalog, especially the mobile functionality. Can you see my screen okay?
Looks good.
Perfect. So one of the cool thing about this is, and I'm going to just do a quick refresh here, is that when you are looking at this through mobile, you have the potential of, first, you can take a look at the table of contents. I'm going to go back. If you wanted to just move very quickly through the catalog, you can use this up and down. If any of your members, and it just took me to this page. Now, if they're looking at this page and they feel like, oh my God, this is exactly what I'm looking for, and they don't want to go to click here and move into the cart, like Emma was just doing a demo of, they can just click here and then dial. And if I were to say open link here, for the mobile, it will not ask me that. It will just, you touch dial, it's just going to start dialing. And now it just started dialing, and I've stopped the call. Right. So the other part of it is you can actually, when you touch more here, you are able to search again still via mobile. You can search any aspect of this. So different ways to get to us using this online catalog. Now, if you want to share, and I know that is one of the questions that just came up, you can share. It's on mobile. You can share to email, through any of these social share, and all of these different ways to share it with your members. And I'm going to just stop there for now. And Emma, there are a bunch of questions, but should we do a poll now, or do you want us to look at the questions before doing a poll?
I said let's go ahead and do the poll, and then I see we've got some questions in the QA form as well. So let's do that real quick, and then we'll go ahead and get into Q&A, because I think we've got some really good questions going.
So the poll here is just to get your insights on what you would like for us to provide training in, right? We are lucky to have Emma here, like I said, who's an authority on these things. So let us know what other training topics you would like to have us do. So if you want to go click on that part of your user interface that says poll, and then provide your choices, that will be great. We'll just take a minute or two here to do this. Now the question is, what training topics will you like? Are you interested in? You can select as many as you like. That will help us with planning.
Love to know what you guys want to hear more about, so we can kind of tailor make some programs and training material for you guys as well, because we know there's a lot of questions. There's so many different things, and boy, oh boy, do they have a lot of nuance and back and forth between just a single topic. Each payer may do it a little bit differently. Each item has its own niche of a process and stuff too. That's why DME is kind of its own thing. A lot of people don't love dealing with it because we know it's not the most straightforward.
And if there is something you like training on that is not on this list, by all means send it to us either via the chat function or as a proposal via the Q&A function. All right, I'm just going to go ahead and end the poll now. And I think, Emma, we can go ahead and jump to the Q&A.
Perfect. All right, let's take a look here and see what we've got going here. All right, I'll go through the ones that are written out first, and then I think we can allow people to sound off with their voice. I believe we have that option, but Bernadine, it looks like, yes. So we can definitely have that sent out via email. If you want, you can share that like Shufai had on there through all kinds of different means, through Facebook or email or Twitter, X, all that good stuff. So definitely an option there. Jill's got, when ordering items online, is there a way to request a monthly auto order of certain supplies? For example, if we wanted to request a monthly order of pull-ups versus a one-time order. Yes, there will be a means to be able to do that. And I think that's a great question and great feedback, to be able to have that within the ordering form as well, especially on some of that stuff that is most commonly done as a reorder, the incontinence supplies or gloves, catheters, things like that. Definitely a great one for us to be able to know, so that we don't have to follow back up and confirm that with you or the member. At this point, we would just reach out and just say, hey, thanks, Jill, for ordering these pull-ups. I just want to confirm these are a monthly reorder or bi-monthly or quarterly or whatever cadence you would like for the member. But that is something we are anticipating adding to the cart functionality, again, just to be able to give a little bit more feedback so that we have more information to be able to work that a little bit quicker. Absolutely. Let's see here. Does the cart work for items ordering from outside the catalog, or will we still need to request those via phone or email? Yes. So if you are ordering something from a third-party website, I know a lot of times we're ordering stuff off of like Amazon or the like. For right now, we do need those via email just because we don't have a way to add the link. I would love to have that as an option as we do version 2. We will absolutely be making changes to the cart functionality, especially for you guys, because I know that is one of the big ones, is the Amazon links and stuff. So I do anticipate that there will be a section for you guys to be able to do, a drop down to say monthly, bi-monthly, quarterly for auto order stuff, and probably a section for you guys to put links in if you are doing some of those items that are, an Amazon link or some other third-party website where you're like, it must be this specific one, it can't be the standard bath bench or something like that. I know those situations do pop up fairly frequently. So for now, email is probably the best way to do those, just because we don't have a way to put the link in there. But with version 2, when that comes out, I would love to be able to see a little bit more of that built into the functionality, so you guys don't have to do that. So hopefully that answers that a little bit more. Devin, speaking from the provider end, it can be difficult to coordinate with case managers to complete orders. Do we as providers have the option to work directly with you to set up orders, bill insurance, generate quotes, prior to case management involvement? Yes, absolutely. We do have many providers that reach out to us directly. They'll fax over the prescription. We will have a section on the cart submission form to be able to attach prescriptions here soon, so that if you don't want to have to fax it over, which I don't know anybody who loves faxes. Sometimes they just go weird places, or they just don't go through and nobody knows why. It's always a delight, but absolutely, you definitely can. And a lot of times we can do the follow-up with the case manager to let them know what the situation is and stuff as well. So if you do want to at least get things started, especially if it's a prescription covered item, stuff like incontinence, bath benches, commodes, seat risers, compression stockings, a lot of those common items, even stuff like lifters, hospital beds, patient lifts, some of the higher end stuff, we may need additional documentation, but that takes time. So if you want to get that process rolling before the case manager gets involved for anything that may have to do with the waiver program, by all means, we are happy to get that started so that the patient is not waiting, especially this day and age where they may be between case managers or being assigned to somebody, in the next couple of weeks, but sometimes that takes a little while. We'd love to at least get everything situated and all the documentation squared away as much as possible before we have to follow up with that case manager, or if they just don't have one yet. So we do have folks that don't have a case manager. Maybe they're just doing it on their own. That's okay too, and we're happy to help assist with that. We can figure out most of the time what the insurance is by just going into some of those portals and poking around to see where they're at. So if you have at least a general understanding of or idea of what their insurance is and can let us know, that's even better. And I know some clinics even include that on their prescriptions these days too, which is great. So absolutely feel free to reach out to us directly, phone, email, cart function, whatever is easiest for you. We will get that in, and also reach out to the member as well, just to confirm all the details and stuff with them. So by all means, don't be afraid to reach out to us. Let's see here. Is there a list of statuses and what they all mean for the quote and order portal? Yes, there absolutely is. I will note that here as well and make sure we include that. I know some of you over the years, especially if you've worked for us for a while, have known kind of some of our work in progress states, and some of them are kind of called funny names. With our new system, we do have those relabeled as things that actual humans can understand, where if you might have called one of our reps a couple years ago and been like, where's the order at? And they're like, it's CC waiting. You're like, what does that mean? Well, it's waiting for a prescription. It was a shorthand that we used many years ago. It made sense to us. I know that does not make sense to anybody else outside the organization. So we absolutely have a key for what each status means. The hope is that when you do log in and can see some of that stuff, more of it makes sense just right off the bat. But we absolutely have a key and a little bit more wording on some of that stuff as well, totally, because I know some of those have been a thing. All right, let's see here. If new items are added to the website throughout the year, what is the best way to find out more about that? That's a great question. Shuf, I might be able to speak a little bit on this too, but I think what we are going to be doing is probably sending out some emails when things get added.
And as you see when you go to the resources, you see 2025 catalog. That's a way of now controlling versions. So when you're coming back next year, you may see 2026. That will show that is a new version that has been updated. The cool thing about doing it online, the way we're showing you, is that we can quickly update stuff. So we don't have to wait many years for things to be added.
So we'll hopefully be moving a little bit quicker on that as well, which is always good. It's good for our reps too, just to know exactly what the newest, greatest, latest thing is. But we will be sending out more of those email blasts for being in the know on things that are going on with us, with the industry at large. things like that. So if it's something that you're interested in, look to see some of those email blasts that will be coming out with more of that information and more details on what kind of training or in-services that we're offering. So if you do want to sign up for things, I saw HED was a really popular one in the poll there. So if you're like, ooh, I really want to know more about lift chairs or hospital beds, that'll be included in those kinds of email blasts as well. All right, so hopefully that answers that question. All right, Heidi here. If equipment needs to be installed, is there an area to request that as well? That is a fantastic question. There isn't a place to put it on the cart right now. The good news is any of our items that do have, that may or may not need install, but potentially should automatically populate on our end with the install included. So if you just don't need the install, one, we should be reaching out to you just to confirm that, or to the member themselves to say, did you need help with this? Or would you like to do that yourself? Does your facility want to do that? Do you have a family member that feels like they would prefer to do that? We do have folks that are just like, you know, I trust my son or daughter to do this more than you guys. We totally understand, and that's okay. So anything that could need an install does populate with a line for install, and we assume that it's needed unless told otherwise. So we should be following up on that at this point. Let's see here. Is there a way to rent a walker while waiting for insurance to approve one? Yes, absolutely. We do indeed do rental walkers. We do a lot of rental items, lift chairs. I know that's a big one because it does take a while oftentimes to get through that process. So if you do have somebody that is in need, until they can actually get their stuff approved through the insurance program or go through the process of figuring out if insurance will or won't cover it, we absolutely do that. Walkers is a big one. Wheelchairs, lift chairs, hospital beds, a lot of the common items. Once upon a time, there were rental commodes. We don't do the rental commodes anymore. I don't know anybody else that does. Technically, there is a billable code for it, but it's just, people don't love that. And so we just decided we're not going to do the rental commodes. I think most people don't want to rent a commode, but absolutely, that is absolutely an option. And we do that fairly often. So very, very good question there. All right, Sherry, Bluestone Care Coordination are doing a majority of ordering since case managers changed. How often can we do a cart order on the website to confirm this? Should we order using our own name as the orderer since that we follow up on those orders, or use the case manager? That's a great question. And for Bluestone, I know Health Partners does a lot of those where it's a care coordinator that's actually doing the ordering, because a lot of the case managers filter stuff down to those aides or care coordinators. Genevieve's another big one that I know. You have specific folks that do a lot of that follow-up. I would say, Shirley, go ahead and do it under yourself, because you're probably the ones, or do it whoever should be getting the follow-ups for the quotes. And I know a lot of times it's you folks, whoever is doing that care coordination for the case manager. And again, exactly like you said, a lot of times that changes. So if you are the folks that need to be getting that service agreement, I would say you are exactly the folks that we want to be putting that in under your information, because that is who we're going to send that quote over to. That's who we're going to follow up on if there's a problem with that prescription, if the doctor just stops responding or never responds. That absolutely feel free to put it under yourself. And this goes for any organization where there is support staff that wants to be that person that gets followed up on or gets those quotes. If we know who's supposed to get the quote, that makes us, makes it a lot easier for us as well to be able to make sure that that email is going to the appropriate place, and we're not creating more work for people that, already have a lot on their plate and stuff too. Great question. And then Candy over here, is there a way to include that the member needs to dispose of some furniture and that it should be included in the quote? That is a great question as well. You guys got some really, really good stuff. I super appreciate the engagement here. There's not going to be a way to put that, at least right now, on this version of the cart. However, as soon as I do see something come through, or one of our staff sees something that comes through for things like a lift chair, a hospital bed, patient lift, those are kind of or mattress, those are the main ones that we see a need for a disposal on. You are going to get an email back probably within a couple of hours to ask all of the rest of the common questions, like if it's a lift chair, what are we disposing of? If we do need a disposal, is there specific, side that they want the remote control on? Are we going to be delivering upstairs, or is there an elevator? We're going to bother you about all of those normal questions and stuff. So the goal here is to make sure that you're not having to at least initiate that. If there is gaps to fill in, we will reach back out to get that stuff filled in. The other thing on here right now is we don't have a spot for the primary or the ordering doctor, so we're asking a lot of those questions right now. But again, this is definitely part of what we are going to be doing to expand that cart functionality and to make it easier. I do apologize that it is not as well-rounded as we would have liked it to be, but that is something that we're going to be rolling out with the next versions and stuff too, because again, this is exactly the kind of feedback that we are looking for and confirming that it will make your guys' lives a little bit easier. Absolutely. Let's see here. Develop a patient portal. Would it be possible to develop a patient portal where each client we reach out to would be able to have their own portal that would streamline ordering and requests? It will probably be something future state that we do have. They may not be able to do maybe quite as much with ordering within the portal as you folks as medical professionals will be able to do, but they should be able to at least see what the status of their order is and kind of track it in real time. I know if some of you have seen some of Dylan's videos that he's sent out, he's one of our owners down here. He had talked about, we can track minute to minute where my pizza is, but I can't figure out where my medical equipment is. We would love to be able to have something that functions very similar to tracking where your pizza is. Are we putting the pepperonis on? Are we walking out the door? Have we opened the car door? Being able to see at every step of the process what is going on and why it is happening. So much of this healthcare industry just lacks transparency, and that makes it so frustrating for people, and that's what gets them upset. I am upset by that too. And I would very much like for people to be able to see that and have control over their own health, especially if they're getting, medical equipment supplies. A lot of their autonomy as a human being a lot of times is taken away, and they feel like they're grasping at straws. How do we show up for them in ways that will make their lives easier and make a real impact for them? That is exactly at the core of what we're trying to think of and answer for as we develop more and more of these tech components and stuff. So I love that. Thank you so much, Devin, for bringing that up. That is exactly what we want to be doing future state as well, so that you guys aren't getting those calls to say, when am I going to get my pull-ups? What's going on? Can I get, the bath bench that I've been desperately needing, so they don't fall in the shower and have to go into a facility and leave my home of, 50 years. We do not want that to be the case for people. I don't want that to be anybody's story. Kathy, let's see here. For installs, what is the range of Minnesota that you cover? We are in southern Minnesota. A little bit of it depends on how far away from us we are. We definitely serve anybody in the 7-county metro area. We do go pretty much anywhere in the state if we need to. It just kind of depends on the item and stuff too. If it's a big item that somebody can't do themselves, absolutely. There's a limit to what a lot of folks can do. But also if it's something simple like a toilet seat riser where the install is really just turning a knob to tighten stuff, there may be somebody at the home, at the group home, at the facility in their lives that are able to do those installs rather than having to pay for us to do that as well. So we do want to work with folks and ask them those questions on a case-by-case basis to see what works best for you. But I have had people go all over the state to do whatever needs to be done. We will find a solution one way or the other to be able to get people the supplies and equipment that they need. That's a great question.
Looks like yes. I just shared the link to the flipbook in the Q&A function there, so you can grab that link and email it to your clients. And I think we've gone up of time here because of the beautiful and amazing questions. So, Emma, I think this is all we have time for. We'll be following up with a recording afterwards. And any last words, Emma, before we go?
I just want to thank you guys so much for being so engaged and asking such great questions and giving us that feedback and stuff as well. So even if you didn't have time to be able to answer or ask everything that you wanted to, or maybe you didn't want in a public forum, which I understand, feel free to reach out one-off. You can reach me directly, any of our management team. We are here to be able to facilitate whatever you guys need, questions, comments, concerns, feedback. We want to know what's going on, what you guys are seeing on the ground, and what we can do to help make your guys' lives a little bit easier. So really, really appreciate everything that you guys do. Thank you so much.
And I know some questions are coming in. If there's any question that comes in after this, we will definitely follow up with you privately. So thank you, everybody. We are looking forward to meeting you in future trainings. Thank you. Have a good day.
Thanks, guys.
Goodbye.